Good morning, everyone. Welcome to episode 5 of the Africa-India Global Dialogue series. I'm Veda Vaidyanathan from CSEP, and I am so thrilled to be moderating this discussion on building resilient health systems. To help us unpack this incredibly complex and multi-dimensional theme, we have a fantastic lineup of speakers today. We have Desta, who's Group Director, Partnerships and External Affairs from Amref Health Africa. We have Njabulo Banda, Deputy Dean of Research from IIE's Varsity College. We have Sandhya Venkateswaran, who's a Senior Fellow at CSEP. And we're hoping that Nithya Ramanathan, who's CEO and co-founder of Nexleaf Analytics, will also join us very quickly. But before we go into the conversation, I'd like to invite Pamla Gopaul, who's co-curating this webinar series with me, to kick us off and sort of explain to us why this theme is important to study, especially from an African or an Indian or a broader Global South perspective. Pamla, over to you.
Great, thank you. Thank you very much, Veda, and good morning and good afternoon to everyone that has joined us today. It is indeed a timely and vital conversation that is co-hosted both by the Center for Social and Economic Progress, as well as the African Union Development Agency and its Policy Bridge Tank program. As Veda mentioned, today's session is held on the 5th month of the year, and it is our 5th session which has been bringing us together as thought leaders and practitioners from both across Africa as well as India. And we've been reflecting on topics that impact our citizens and our economies. But today, more especially, we will be discussing one of the most urgent challenges of our time, and that is how developing countries can build health systems that are not only resilient, but adaptive, inclusive, and future-ready. So the health is, we know, a foundation of human development. It's a foundation of economic stability as well as social cohesion. Yet across the Global South, health systems are under increasing strain. From cascading impacts of climate change and pandemics to shifting political and economic landscapes and the retreat of traditional aid models, these disruptions are not just stress tests. They are signals that we must rethink how we design, how we finance, and how we govern health systems. The central question guiding us today in our dialogue is, what will it take for developing countries to build resilience in health systems? And it is more than just a prompt for reflection. For me, I think it would be a call of action and a call that will re-image policy frameworks and to elevate the regional leadership to ensure that health systems are grounded in local realities while informed by global solidarity. Through this conversation, we will we hope actually to surface insights from our experts and shaping smarter, more equitable policies, whether it's through innovative domestic financing, whether it's cross-regional collaboration or strategic use of data and technology. We hope that the spotlight and the leadership and the lessons emerging from this Africa-India dialogue becomes an increasingly influential global health discourse. And with that, I would like to hand over to my colleague Veda, who will further set the tone and frame today's discussion. So thank you again for being part of this important dialogue, and over to you, Veda. Thank you.
Thank you, Pamela. Thank you so much. Just a quick reminder to our audience, this is a 60-minute program, so we'll moderate a conversation for about 30 minutes, after which please feel free to raise your hand or even jump in and ask questions. I'm hoping that this will be pretty interactive. But Desta, if I could start with you. I was listening to this fantastic podcast you were on, Connecting the Dots, and you were talking about your incredible personal journey, and you were talking about your early days in Amref. And you kept sort of emphasizing the importance of African voices, about highlighting and underscoring and empowering African voices. So in this broader discussion on global health systems, like Pamela mentioned, there's so many disruptions going on from climate change to pandemics. So how can experts like yourself work towards strengthening or work with developing countries and governments, especially in Africa, to build resilient health systems? Maybe let's just start with a big meta question and then we can take it from there. Desta?
Thank you so much, Veda. And that's really an important, I'm surprised that you even heard that Connecting the Dots podcast. I don't think I've heard it since I've said it. But I think, let me start with, I don't know how many people know who Amref is. And Amref is the largest health development NGO in Africa. And we work extremely closely with governments in the countries in which we operate. And we also work in communities with the people, delivering service and, providing interventions, health interventions. So we are sort of unique in the way that we operate. And at the community level, it's really how do we get people at the community to really access first level care? So we look at these dynamics, and now, like today, for example, we are really facing a huge crisis. I mean, we're facing actually a meta crisis across the continent, and of course, in other continents as well. So it's not just about are we delivering the right care? Are we leveraging the right tools to deliver technology or otherwise to deliver the care we need? Are we making sure that people have access to and are connected to health delivery? It's not just that anymore, which was our biggest struggle and focus. But right now, it's really about countries that are not enabled to be able to invest in and deliver the type of services that they need. So not just, ODA being reduced, but it's also about, foreign debt servicing. It's about the global health security space that we're seeing. And ODA is not just USA, but it's also generally seeing other European funding streams or countries stepping back. And so what we are seeing increasingly is African countries are saying, you know what? Maybe this has been going on for too long. We must now begin to take the lead. And what do we need to do in order to do that? So even at the recently concluded WHO convening, health financing was a very big topic that came through. And it was really about, how do we bridge that gap? What kind of partnerships do we need? I work within partnerships. So what kind of strategic partnerships do we need? If we want to bridge that gap, what type of, and the kind of partnerships that we're even hearing about is not just partnerships, among private sector and other development partners, but also what kind of partnerships do we need in terms of South-South collaboration and learnings? So, I mean, I was even facilitating a discussion on India and Africa collaboration. What can India bring, learnings can India bring to Africa? What can the African colleagues bring to Asia? So it's really looking at very new types of models for South-South collaboration, but also across Africa itself. We made recent progress that we made on the intra-African trade agreement, for example, really opens up the doors for investment towards, industrialization, an inclusive development agenda. It gives us really hope that we have now an opportunity to reshape markets, for health innovations. It gives us an opportunity to think about how can we push for local manufacturing. And I'm sure many of you know, Africa, 90% of vaccine manufacturing vaccines that Africa uses comes from outside. So how do we push for local manufacturing? How do we ensure that there is equitable access to life-saving products? And then how do we leverage also those partnerships that we have to help us, create favorable regulatory environment, look at technology that we can leverage. It's a whole learning space for us. And I think that we are now seeing Africa take ownership for creating the space to grow and to reduce reliance on foreign support, foreign aid. I think I'll leave it there.
Thank you, Desta. Sandhya, if you could build on that, because you helmed the Asia Collective for Health Systems, are there similar conversations happening in that part of the world that you study as well? This question of ownership and taking a completely different view.
Yeah. Thanks, Veda. So I wanna build on what Desta said. That for a long time, the whole notion of building health system in developing countries was sort of looking inwards within the countries, what we can do. But there is a growing recognition, or it's a grown recognition, that geopolitics, diplomacy actually plays a very, very big role in terms of how the global south, if I can call it that, is experiencing health, the delivery of health. Because, when we look at what it takes, I think we can divide it into two broad elements: what is to be done and how it's to be done. Now, in today's sort of world where knowledge can be shared easily, the what is to be done is not very difficult. But how do you do it is what becomes critical. And that's where these collaborations are super useful. And what I mean by how is, where will the financing come from, as Desta already referred to? What are the kind of institutions that are required? What are the governance mechanisms and processes? How do you seek accountability, contextualizing it to the specific country or geography one is talking about? That's the kind of sharing that's super important. And that's what the Asian Collective for Health Systems, it's a mouthful, I always bite my tongue, the Asian Collective for Health System, TACS as we call it, we've created this a sort of a platform across South and Southeast Asia, and that's what we are trying to do. Bringing countries together, bringing a range of stakeholders across countries to do sharing on two broad things. One is, how do you implement policies that countries are aware that are needed? And the second is, again, Desta referred to that, how do you strengthen the Asian voice within global institutions and global governance mechanisms? I think the pandemic highlighted very clearly that global governance mechanisms are not working very well, right? The COVAX was instituted for equitable distribution of vaccines. It didn't happen. It didn't happen because at the end of the day, nationalism comes in, health security comes in, the whole divide between the richer and the poorer countries comes in a big way. So how can the global south negotiate some of these institutions and processes in the interest of global equity? That is what much more discussion is needed on that. So TACS does that within Asia, but I would broaden it. I would say different regions need to have these conversations, right? So whether it's Asia, Africa, countries of Latin America, other global south countries need to have much more conversation on navigating some of the global governance institutions for health.
Thank you, Sandhya. Njabulo, coming to you, would you also like to build on that? This question of how do we do it? You are based in a research organization within a university, and you're one of the key knowledge producers. You've spent a lot of time working for PEPFAR in the grassroots. How do you sort of see this?
No, thanks for that, Veda. So yes, I would like to add, because I think both Desta and Sandhya have raised very valid points. And actually, as you're asking the question, I was definitely going to use research as one of the points. I didn't actually plan to, but now as the ladies are talking, because some of these things that are lessons learned are there in research. I find that, especially from the time of COVID, I know that COVID is overused, really as a term and as a point of departure. But it's very important because there's a lot of lessons learned from COVID, and they didn't start with COVID. They were just, illuminated during that time. And so research shows a lot of things that are working in different countries. And I'm saying this point in light of the discussion that is talking about learning amongst each other as African countries, especially from what Desta was saying, that in the communities at grassroots level, there's a lot that is happening. I mean, there were countries that were able to create medicines that were able to prevent people from getting COVID. South Africa has pioneered a couple of vaccines. In other countries like Kenya, in other African countries are developing certain very important sort of innovations in medicine. And so it's a pity. And this pity for me is I will term it as a slow-paced response. I think we are not responding fast enough. We know that there was COVID. We know that there's been, for example, funding cuts in many African countries. And it's not just now that the president of the USA came with this. Talk with PEPFAR has been ongoing, but the response is just not fast enough for things that we know. Just like Sandhya was saying, it's not that we don't know what to do or we don't have the ideas, but it's the pace at which we are moving. It's just not fast enough where we know what we're supposed to do. We've got lessons learned, we've got the resources. And yes, everything is not perfect. A lot of African countries are very much dependent on funding and, external help. But for me, the main issue is really the fast pace. I mean, the slow pace at which we are responding to things that we know should change now. I mean, COVID was really was a wake-up call for us to say, your health systems are dilapidated. Your infrastructure is not ready for any other thing. What have you been doing with all the funding that we've been getting? Because there's a lot of funding from all the other, partners. And so for me, it feels like we are not utilizing the funding fast enough for us to show that we are intending to one day be this independent or intending to own some of these programs. With that said, I just want to also make a point about the inequalities, because for me, when I think about health system strengthening, it really always reminds me of the inequalities that are in some of the countries of the global south. For example, in South Africa, we have South Africa and Algeria. In fact, we have this good, well, they are perceived as good primary health care sort of systems. But at the same time, there's a lot of health inequalities amongst the citizens. And that is really, it really tarnishes the image of health, because there's a lot of services that people cannot get from the public health system. And I believe that if we strengthen health system strengthening, we are strengthening an already existing system. I mean, there's talks of national health insurance and all of that. That will not come if we are already not able to make sure that we capitalize and maximize the use of something that we have. I just think that we kind of maybe are downplaying some of the lessons that we have learned and some of the strengths that we have. We're not building. And of course, this takes me then to Sandhya's point about the outward look. It's definitely, it's true that the outward look, the global look, there's a lot of value to be learned from the global sort of perspective and guidance. But if we look inwardly, as a region and as maybe countries especially because we've got a lot of similarities, then we will build on that, and then we will learn, because we will build on things that we know are working. We are not going to be, just fabricating things. And that's just what I would want to say. Thank you.
No, thank you. But I just want to build on that and sort of do the next round of questions. Njabulo, you spoke about not responding fast enough. Sandhya, you spoke about, we already know what it is that we need to do. I'm right now in Lusaka for a conference, and the last few days we've been talking to scholars and academics from across the continent. And one thing from Algeria to South Africa that everybody's been saying is that there's no lack of policy prescriptions, right? There are so many policy documents. Pick a topic and there's a policy prescription, right? We have 10-year agendas, 50-year agendas, we have 100-year agendas and all of that. But then when it comes down to policy execution, when it comes to implementation across sectors, there seems to be a complete gap, really. And I'm just so curious, because this came up in so many different conversations. So in this health sector, as we reimagine from our own local context, how we can build, or like Njabulo said, take down existing systems, rebuild new, more inclusive systems. How do we bridge that gap between, we know what we have to do, but how do we actually do it? Sandhya, do you want to start?
Yeah, sure. So that's a tough one, Veda. And I'm tempted to take the conversation to a slightly different level of, what we often refer to as political will. Because I think we all recognize that there are many policy prescriptions. In fact, perhaps one could argue too many policy prescriptions. So why aren't things moving? And I think many studies have been done. Recently, we were part of, a study with the World Bank, and they were looking at to what extent have countries prioritized health or increased their budgets after COVID, because COVID was in many ways this big wake-up call, right? But it hasn't happened. It hasn't happened. I mean, budgets have been stagnant. In some countries, they've gone down. So why is it that country governments do not prioritize health? And health is a complex area. It's a complex sector. One argument could be that the benefits of health reforms take many, many years to come, and politicians actually look at their electoral cycle, and they therefore only want to do perhaps what can show results within that cycle. But I think one big task is to look at countries that have taken health seriously, that have actually implemented policy, and what is the benefit that that gave them, right? Benefits in social terms, benefits in economic terms, benefits in political terms, and have many more conversations with other countries that when you prioritize health, when you actually put your weight behind the policies that need to be implemented, this is what you might gain. And I think perhaps there isn't enough of that happening. So that could be one pathway forward.
Okay, taking notes. Desta?
Thank you. I'm so glad you asked me, because I was just thinking about, as Sandhya was talking, I was saying to myself, yeah, that's true. Yep, that's true. But I think what we need to remember are a few things. I think we need, for Africa at any rate, the majority of our countries are servicing foreign debt. And therefore, what is remaining is not sufficient to be able to do all the things that you want to do. Our health ministers are operating with very limited budgets. That's number one. So even if they know what the solution is, their ability to stretch that budget is limited. That's number one, because that's what they get from Treasury. When you look at even the way we provide services, it's very fragmented. It's very fragmented. And why is it like, what are we prioritizing? Countries, for example, we've had this whole 2-year process, first of all, called the Future of Global Health Initiatives, and then the Lusaka Agenda. Many of you may have already heard of that. And I sat on that in that process, and it was driven by global health institutions, donors, of course, and other key actors looking at, how can we asked in one of our meetings, we asked countries, what is the biggest challenge that you have? There's Gavi, there's Global Fund, there's, all of these that are offering funds. And, what's the biggest challenge for you? So even the ministers of health said, the opportunity cost is very high for us. Like, if we know that we're going to get money from Gavi or Global Fund, that's what we focus on, because that's where the resources are coming in, right? And so I think we need to look at what are countries facing. Countries are facing a number of things. They're facing, reduced budgets, not being prioritized for everything that they need, but even the donors are driving the agenda, the health agenda, because that's where the money is. So if you are going to get money, and if you know it's Gavi that's giving you money, well, by golly, you need to focus on making sure that zero doses children are addressed, or you need to focus on HIV, et cetera, et cetera. When PEPFAR funding was around, you were able to do what we were able to do, whatever we needed to do to address that story. So I think the challenge that we face is governments in general do not have flexible funds available, or cannot necessarily top up the coffers for ministries of health. And then ministries of health are also, as many other donors, non-government donor actors like civil society, we rely on the donor priority. So even when you know what the solution is, you have to say, where's the money coming from? How is that money arriving? And how do we deliver care based on what we have? Right? Which means things are fragmented. And I think that's something that's, if we are able to generate, as the interest that WHA showed me, if we look at private, PPP partnerships, if we look at development banks, if we look at, we always say to deliver UHC, we need private sector. Has anybody asked private sector what their role in delivering UHC is? Do they even know? Are they informed? And so I think that we have a big role to really play in terms of exploring, what does PPP mean? What is the role of private sector? Private sector is there to make money, but we can actually leverage private sector also to build and strengthen our health system. So I think we need to look at, if you follow the money, you will understand why we're not necessarily meeting our goals. And I think that's what we need to do, is we need to follow the money. And if it means that we need to develop partnerships that will enable us to do so, then that's where we should focus.
Thank you.
Over.
Thank you, Desta. Njabulo, what should we be focusing on? What else should we be following other than the money?
We should focus on monitoring and evaluation. I'm like a firm believer in data and use of data. And I found, when you started off asking your question, I was thinking about, I think I shared it in our talk as well when we chatted earlier. The African Health Strategy. That is it's a strategy of the African Union, and and I don't think it's very famous or well known. And not just that, if you look or investigate a little bit more into it, you'll find that there's not a lot of data written up on how well that has been used or taken up by the African Union member states. And for me, that's one of the reasons, or one of the strategies that is not being used. You started off by saying that African countries are very good at policy. And I think that we are too charismatic in being good at policy and not putting a plan to monitor that policy. All our policies, most of them will say it's based on Agenda 2063, the Africa we want. It is aligned with the Sustainable Development Goals. It is aligned with this. It is aligned with that. And then now you're looking for a plan to say it's fine that this is the policy that we're going to look at for the next 5 to 10 years, maybe. Where is the monitoring plan? So where we're going to measure ourselves? I understand that it might be through funding or not funding, or whatever programs and activities we put in place. But it's almost like, that saying that says, if you fail to plan, you plan to fail. And I think that if we fail to plan to monitor, how are we going to move? And that's, I think, one of the main things that is lacking in our policies, that they are there. There's no monitoring. There's no monitoring plan. And I'm not saying there's none at all. There could be some, and there could be some milestones or some objectives. I mean, the plans, for example, in Agenda 2063 have got objectives and targets. But how measurable are those targets, and where do we measure them? And where's the conversation happening? And what is it linking to? I mean, if you look at Africa, things about peace and security are tops. I've been to at least 3 African Union summative meetings where like the peace and security talk is really straightforward. And I understand that we've got a big issue in our country, in terms of wars and all that stuff. But that's not the only issue that we have. And I understand that not all problems can be equal. But I'm just saying, in light of these health policies, that I think really one of the key things to drive it is to have that plan. And it's a pity that Nithya is not here, because I know that you'd be talking about the data part. One of the things that is also evident in most systems is the lack of quality data or health information systems. And this is why the donors are able to twist our arm. Like Desta is saying, they use data. They will come. I mean, the paper programs that I've worked on, one of the things that we excelled in all the departments was our ability to churn out numbers. Even if there was load shedding, there was ways we would find to get data and get computers running and link them to a place when paper time comes for reporting, we are ready. We have the numbers, all the templates are populated, and there are no excuses that are going to be taken. And that's the drive from the donor. But that kind of drive to get the data, and this was, let's say, for example, HIV data. That is why the HIV program was so successful in Southern Africa, is because the data was topmost. And other programs, especially like chronic programs, are not being managed so well. For non-communicable diseases, the country's health profile is showing that that's the direction that we should be moving but we are not able to move now because we had this funding from these funders, and the mandate is that we follow, and we don't have enough data to work and plan and say, actually, we want to do this. You know what I mean? So for me, really, data quality and monitoring and evaluation are key things. And I feel that countries are not taking it seriously enough. Thank you.
Veda, can
Yes,
I add
Sandhya.
a very quick
Of
point?
course, of course.
Give me 10 seconds. So completely agree with the data point that Njabulo raised, but I want to go back to what Desta said about we're following the money. So the question really is, how do you get the money to follow the needs of some of the developing countries rather than us following the money? And that goes back to the earlier point that we made about South-South collaboration, the need for much more South-South collaboration and a much, much stronger and louder voice that can actually lay very clearly and sharply on the table, these are the issues that we need money for. So whether it's the platforms like, Gavi, Global Fund, et cetera, or even, other donors, individual donors, and the stronger the voice will be, the more the potential to be able to influence where their money. I know there are many factors that go into it. I'm being a bit simplistic, but it just speaks to the need for much stronger South-South collaboration. And the voice of the South is really what I'm saying.
But can you build on that, Sandhya, a little bit and sort of take this conversation home in the sense, what are ways in which India can work with countries in Africa in this global health, in this conversation? I think, Desta, I'll come back to you because you said you moderated a panel. Do you want to start, perhaps?
Yeah. Let me just say really quickly, and I know we have time issues. So we actually, as Amref, okay, so when we started talking about UHC, let me just step back a little bit. So when we were talking about UHC, we said, and at that time, our group CEO was co-chair of UHC 2030. So we began really working with the Public Health Foundation of India and Amref. We coordinated South-South dialogues. And it was not just with India. It was with other Asian countries as well and African countries. So in that conversation, it was about, let's learn from one another what works really well in order for us to move towards UHC. And in fact, we held meetings, we held in Bangalore, we held in Vietnam, we held in New York, even at Unga. We held in, I think we had one in Kenya, and certainly we held one we held one in Africa as well. So in those meetings, it was very interesting because what we saw was this learning exchange. And in fact, in our meeting that we hosted in New York, the Kenya Minister of Health at the time actually asked, I believe it was the Thai Ministry of Health, to support them in knowledge transfer on health, on data systems. So coming back to what Njabulo said, it was really about we need to capture data to really understand, number one, where we are. Number two, to inform the funding that's needed, and also to really drive efficiency. So what is the system that Thailand, I believe it was Thailand at the time, this was several years ago when UHC was just, what is the system that Thailand is using that is optimal that also Kenya can now adopt? And it created those type of synergies. So, my view is, even when we look at, what do we need to do? We definitely need data. Njabulo is absolutely right. We need data for everything. So if we need data, what does that mean? That means that we need to invest in digital health technology so that we can get our data. That means we need to look at community level data, not just data at the top. So all of those type of things. That means we need to look at governance for data. Those are all things that you need to do. You can't just create a system and say we're collecting data. Who owns the data are the national governments that own the data. So how do we make sure that across regions, across countries, there is sharing of information? And I think that part of that is around harmonization, regulatory harmonization, and data sharing agreements. That's how we will know how successful we are. Years ago, when I first came to Amref, that was quite a long time ago, I had a partner who came and said, we want to do this in Africa, first time partner, private sector. I said, sure, it's fantastic, let's do it. And then we came back and we gave them a proposal. And they said, well, in India, it costs X per capita for us to deliver this program. And so the fact that in Africa, we couldn't demonstrate that our space, our environment is different because we didn't have the data, all we could say is, that's great if India can do this for $1, but we must do it for $2. And we needed to sort of rethink, and the way we're actually even looking at partnership. We needed to realize that we didn't have sufficient data to really give us the kind of numbers that these guys were getting from India or from other countries. And so cost benefit is also data, comes from data. what's the cost benefit of doing X intervention? Comes from your data. If you're collecting data and you want to know what intervention has worked the best, here's the data that's going to give you that. So I 100% agree, Njabulo. The data is at the heart of everything. It's understanding our problem, it's funding our problem, it's convincing people that we have a problem, it's it's really at the heart of everything. So even as we follow money will only come if the data informs the decision making. Thank you.
Thank you. Sandhya, building on that, so data building, I think somehow contributing to these public health data systems is one tangible area that I see. What else would you think are areas of potential collaboration?
I would go back to once you have the data and once you have the evidence, how do you actually create space for that voice in global forums? Global regional forums. And, coming back to, since you referred to TACS, the Asian Collective for Health Systems, that's one of the aims of TACS, that how do we bring Asian countries together, not all of them, a subset of them, and strengthen the Asian voice within global forums, obviously with data, as Desta has just underlined, as Njabulo mentioned, and talking about how some of the current processes are impacting Asian countries, what are the issues here, and how can the current governance actually improve the status of those situations. So it basically boils down to how do you play a stronger voice. Even when we look at something like G20, these shifts are happening, right? India is playing a stronger role. South Africa has played a role. Indonesia before that, Brazil. So slowly there is a much sharper Southern voice that's coming into some of these. And I think what is required, which of course speaks to the whole issue of data, is accountability mechanisms. I can't help but refer to the recent, pandemic treaty that's been ratified, and it's quite amazing. It's so many countries have signed on to it. But the question that keeps coming to mind is, how do we ensure adherence to it? That does WHO, and this does not necessarily about WHO, other institutions, what are the mechanisms they have to ensure that countries actually comply with these treaties? Because there are many treaties, there are many agreements, as all of us have said. Where is the data to show that countries are not complying? And then what happens when they're not complying? So I think those mechanisms have to be put in place. And in order to put those mechanisms, the southern countries need to have a much stronger voice.
Thank you.
And
Thank
we're
you,
trying to
Sandhya.
do that with Asian countries, but I think it needs to be done across the board, not just within Asian countries.
I think, honestly, if any policymakers listening to this webinar, you are all already making the case for why it has to be across the board. And there seems to be so many similarities and lessons and so on. And Njabulo, before I jump to the audience, and I just want to remind everyone listening, feel free to raise your hand. I'll call on you and you can ask your question. Could you, Njabulo, could you also give us a sense? You've dropped the data bomb, but beyond this, how can countries in the global south, do you think, collaborate together, particularly countries in Africa with India?
No, thanks for that. I think, yeah, I don't have really anything more to say, because I think both the other speakers have really added onto the point so nicely. I just wanted to, and I'm not sure if I'm allowed to ask a question. I'm going to ask just for a follow up on something that Desta mentioned earlier about our governments dealing with a lot and not having a lot on to work with financially. And I cannot leave this webinar without asking her thoughts about corruption and how that plays, because there's also that impacts on the prioritization of health politically, especially, and where the funding goes and how it is managed. For example, if we're talking about the data issue, it's making me think about how much the like computers and cords and wires and things get stolen in the public health clinics. And so that is all part of, just an ongoing, not unmanageable situation of corruption and lack of care. So I just wanted to find out that, because there are things that, yes, of course, our governments are dealing with a lot, but I think there are things that that do impact on our activities, on our finances, and on our data, that are things that are within our sphere of control. And I think that's where my question is. Yeah.
So let me just come in and answer this. Sorry, Vida, I'm just jumping in here.
Go ahead.
Well, that is a very, very valid question to ask. Do I have the answers? No, I don't have the answers. But what I can tell you is that development partners that give funding, like when you look at, there's Africa CTC just did a health financing report, which they launched during WHA. See if you can find a version online. But what they'll tell you is, and I don't want to say the numbers wrong, but essentially the majority of development financing that comes from outside doesn't come straight to the ministries. It comes through other partners. So I think, as a donor, for example, all you can ask for is, you can ask for impact. Show me the impact of what this is. We cannot, donors cannot go in and dig through what's happening, and corruption is there. Yes, we know that, we're aware, and we have to create situations and spaces in which we can minimize that corruption as much as possible. During the biggest challenges, during COVID, for example, there were many partners that said, Amref, can you please facilitate this for us? We would like to put whatever hand washing station. We want to train health workers. So sometimes you have to find an intermediary to sort of compensate for that. But if you look at Africa CDC's report, you will see, I think, and I'm so sorry, I just don't have the numbers off the top of my head, and I don't want to lie about it, but a substantive portion of ODA actually does not go straight to government. It actually goes outside to other development organizations. So, and that's not something that we'll be able to solve, but I think as countries are pressed to find financing to deliver health, they will also begin to look internally and clean up any corruption, because that's, we have to look at ourselves. Right now, the situation is forcing us to look within ourselves and saying, hey, do we not have an agenda? Do we not have a responsibility? Can we not do it ourselves? And the minute we start looking inside for the money, then we have to also set up some kind of systems to ring fence funding for health and make sure that it is not touched in any other way. And I think that's something that ministries of health are beginning to realize, is we must ring fence financing for the most important health interventions in our country. So, I think when we start looking inside, that corruption will go down.
Thank you, Desta. Before I call on the audience, I see that Miriam Itiera Tolu Fadirin, I see you in the audience. I was wondering if you would quickly like to come in and speak to any of the issues that the speakers have brought up today. You cannot be in the audience and not have a say. Miriam, okay, I thought she switched off her audio, but maybe not. Nandini, I see that your hand is up. Would you like to ask your question?
Yes. Thank you, panelists, for an amazing and insightful discussion. I'm Nandini Khandelwal, and I work as a research intern at the Indian Council of World Affairs. So my question is related to the US aid that has ended now, paused for now, but there has been uncertainty related to it. And my question interconnects the corruption part, the misgovernance that African governments are facing, and the USAID which has ended, which has paused, and the uncertainty related to it. So how what is the policy future of Africa? how will African governments are going to deal with this uncertainty now that US aid has ended, paused, sorry again, paused, and because there has to be political accountability. And we have seen like how Desta, like you has mentioned, that there is debt, which is the problem for the limited budgets of African governments, for which they end up taking loans from the donors, and they end up driving the agenda. But there is also this question of political misgovernance, right, which drives this vicious circle of limited budgets, the corruption, and end up with the poor execution of policies. So what is the action plan of African governments with the uncertainty of US aid? I hope I was able to convey my question.
Sure. Yeah, thanks, Nandini. Desta and Njabulo, would you like to take a stab?
Well, what she asked is relates back to what we were talking about earlier. I think that countries have realized that they are now having to be, Africa is not one country, just as actually India is probably not, it's considered one country, but with 28 states, you could be a continent on your own with the 28 countries. So when you think about what are African countries doing, for example, there will be 54 different answers. Count on it. I think the most important thing is to say, where are the 54 African countries aligning around? And for example, R&D and manufacturing is an area they are aligning around, particularly as it deals with health security and all of those things, pandemics, etc. So I think given the current situation we're in terms of funding, countries are now saying, you know what, we should be able to learn from one another. And in fact, I attended 2 events where African countries, and in one India was in one, but there were 2 different sessions in which African countries were talking about, okay, what are different models of financing our health systems and building our health system. So part of that is looking at private sector. Part of that is looking at development banks. And I think that looking at other instruments to finance the health systems. And the other part of it is, how do we learn from one another so that we're not, we're being as efficient with the use of our resources as possible. So if, for example, India has really mastered the art of digital technology and maybe even leveraging AI, that is something that countries can learn from the mistakes of India, from this, how they have been able to implement that, etc. So I think we're looking as African countries, this was my take coming out of WHA, is we are looking at different ways. We are actually beginning to say, no more blinders, let's just open up our thinking process and let's see what is the role of private sector. And when private sector comes in, I mean, one of the things that was a big issue, for example, when we talked about private sector, is this whole area of purchasing equipment, that diagnostic equipment and servicing. So there are different ways you can look at things, and governments are saying, for example, ministries of health are saying, one of our challenges is, how do we get diagnostic equipment into our facilities? First of all, how do we afford building our facilities, right? In that situation, you could look at a development bank, whether it's the Africa Development Bank, whether it's the Asia Development Bank. There are development banks that are willing to provide funding for these kind of major capital projects. And then you look at what kind of agreements and relationships do we need to have with private sector. When we buy equipment, how is this servicing business going to work? Because no one wants an elephant in their facility. So you really now have to begin to think about, and I think that's what I saw, is ministers of health saying, we need to rethink and just open up our mindset to explore different opportunities, whether it's PPP, whatever it might be. We need to really open up and explore that. So that's what I saw. And whether or not development funding is coming back, we don't know. Already we had seen a reduction because of the the war, etc. So I think we need to start looking within, and I think that's what I see our countries doing.
Thank you, Desta. Before I go to you, Sandhya or Njabulo, I just want to quickly add, Tolu Fadarin has added a question. She's unable to mute herself, and it's very similar to what Desta was just talking about, the role of the private sector. And she's asking, particularly as it relates to digital tools and building health infrastructure, with the global retreat in aid and governments inundated with debt, how do we leverage the private sector without driving inequity? Sandhya, do you want to go first?
I think, I mean, Desta has spoken to this to some extent in any case, and I think private sector is already being leveraged by many countries because it's a reality that's not going to go away. However much we may want that health system should be entirely public run, many countries, even countries like Thailand, let me say, right? I mean, many ways the poster country of UHC, increasing private players coming in. So this is a shift that we're seeing, that there are many private players, and it is important to find out, to identify mechanisms of engaging with them. Where digital tools are concerned, yes, and I speak for India right now. I think COVID demonstrated how private sector partnerships can work in because many digital tools were developed by private sector and they were used across the country in different ways. I think the main concern with the private sector is how do you ensure that equity will be maintained. That when the private sector comes in, obviously private sector is not in the business of welfare. Private sector, by definition, they have profit motives. So the question for governments is how do you engage with the private sector to ensure A, equity, B, that the poor don't end up paying more out-of-pocket expenditures. Yeah. And there are examples from all over the world where that has been addressed. So I think this is here to stay.
Njabulo, before I come to you, bookmark this question on private sector if you had things to point. I also quickly want to call on Ravi Budhalingam, who's had his hand very patiently raised for a while. Ravi, would you like to go?
Thank you very much. Excellent presentation and really very important subjects. I have two questions triggered off by what you said, Sandhya, about the difficulty of making health an effective electoral agenda, because what health ministers see as a return on investment which is too far away to have an impact. So my question here is that in India, we have very many provinces of very varied economic development and status. Some have done a very good job on health and others have not. If you take a state like Tamil Nadu, for example, they've had a fairly good record for many, many years. And one of the things that they have done is focus a lot on women as part of the electorate, because they are seen as custodians of the household and so on. So can any kind of knowledge or transfer of experience be drawn from collaborations with Indian provinces, which are at different states of development, in order to kind of chip away at this electoral dilemma of the African ministers or health ministers, that health is not a workable electoral issue. Actually, in some states, the story has been quite good. My second question is that in China, two financial institutions, the AIIB and the New Development Bank was set up on the basis that they would be very different in terms of their lending policies. Now, what is the record of their lending as far as health is concerned? Have they taken a different position from the traditional international lending agencies? These are my two questions. Thank you.
Thank you, Ravi. How loaded for the last 5 minutes. I want to make it slightly more complex for our panelists and just sort of say, so you have an India state question. Sandhya, perhaps you could speak to that. And then, of course, the question of Chinese lending. And also, if you could just help wrap up by giving us your final closing statements, that would be great. In a minute, 2 tops. Sandhya?
Oh dear. Okay, so Ravi, yeah, that's a great question. In fact, that's something that at CSEP we've been looking at quite a bit, because we do believe that at the end of the day, that's really the critical question of, whether you call it political will or by any other term. You're right that when we look within India, the situation is very diverse. But the example that you've taken is Tamil Nadu, and most people take that example. When you look at the history of Tamil Nadu, history has had 100-odd years Dravidian movement, which has prioritized social justice. And that has what made the state focus on health equity in a way that perhaps we haven't seen across many other states. And I'm tempted to add that it's not just health in Tamil Nadu. The social justice agenda spreads across, whether it's education, whether it's, you would know that midday meal program started there, social policy, etc., etc. So there is a history of Tamil Nadu that makes it happen. In other states have also prioritized health, but not quite in the same way as Tamil Nadu. Rajasthan is a very interesting state where every 5 years the political regime changes, but every new leader does bring in some interesting health reform. And in some cases, we feel that leaders do this because they want to be seen as welfare-oriented political leaders. And therefore, it's important for their identity or their sort of, what shall I say, political legitimacy for them to focus on these areas. Sorry, Veda, it's very difficult to respond to this in 2 minutes. I'm very happy, Ravi, to have a longer discussion on this at some point. But Veda, to your thing, wrap it up. Yeah, I think South-South collaborations are very important. And I think we must look at the whole issue of politics, whether it's politics within a country, responding to Ravi's question, or whether it's geopolitics, and see how health can be made central to the political discourse. Let me end with that.
Absolutely. Njabulo, why don't you go next?
No, thank you. Thank you for that, Veda. So let me just start off just by commenting on the infrastructure question. I really like the discussion, but yeah, I think, a lot has been said. I just wanted to add that, just like Desta was saying, that some of the responses especially in Africa, will need 54 different kind of responses depending on the country. And I was thinking about, we talk about the 4th industrial revolution and how we're moving towards AI and all of these things, but that has a lot to do with infrastructure. And when you talk about infrastructure, you are now including the community and the districts and the grassroots people. So I just wanted to say that a lot of what we're discussing now, that the governments are really going to have to do a little bit more in terms of engaging the users and and the service, the target markets, which is the community, because we have a lot of these talks and we don't have them in mind. We don't know what they prefer. In some of the conferences that I've been, where we're talking about AI, different African countries have got different use of even social media. And we saw how powerful social media was during COVID for misinformation, for talks about vaccination. We should use that. But not all countries use all social media the same way. And so I think that just should be at the back of our minds. But in closing, I just want to say that I think that definitely, as much as African countries cannot now, like Desta was saying, and Sandhya said as well, we cannot do without funding, whether it's from private sector or whether it's from global donors. We can certainly be weaned off. And whilst we are being weaned off, I wish that we'd have at the back of our minds that no one is coming to rescue us. So in whatever plan that we are doing, we should know that we are our own solutions. And that should help us to come to any meeting knowing that we're still trying, might not drive the conversation fully, but we are at least trying to have a bit of agency in where we are going, because no one is going to save us. Funding might drive the program, but it's not going to save our people. Thank you.
Such powerful closing statements. Desta?
Yeah, thank you. Just let me respond very briefly to the question that was asked earlier. And I think there was the question about, for example, China and trading, etc. China is a very interesting and unique example, because if you look at Africa, just Africa alone, China really focuses on infrastructure development, roads, etc. They are the ones that have just built the Africa Center for Disease Control building in Addis Ababa, Ethiopia. So China is very, very much invested. They have a very different type of relationship with African countries. If you look at 2003, I think there were 18 countries in which China did trade and investment. And that was about 35% of Africa. Last year, in 2023, China was in 52 countries. That is 97% of African countries. So China has a very different, it's not a philanthropic model, it is a business model. But the one thing that I realized that I forgot is when we were talking about, countries need to look at different ways in which to collaborate with one another, work with AFTA, for example, the Africa Free Trade Agreement, to make sure that we can work together, use digital platforms to inform decision-making and investment choices, all of those things. There is one party that we didn't mention earlier, and that's what is the role of philanthropists. So when we think about, for example, a Bill Gates saying, in 20 years, I want to die with, or I want to close my foundation and know I've finished my funding. So what is the role of philanthropy? Because there is a lot of philanthropy out there. And I think that one of the things when we talk about where does the money come from, we can even look at philanthropy to help really catalyze it, investments that are needed in, for example, technology to drive data, or R&D and manufacturing. So I think that there's also a role for everyone in the new model of financing health for Africa, and certainly I think we can learn quite a bit. And I really appreciate this conversation. It's been very interesting and I think useful.
Thank you so much, Desta. And I think you've also then covered the question that Anushka Gupta put on China. Nadine has another fantastic question, but unfortunately, I don't think we have time for that. I'm so sorry, Nadine. Pamla, if I could quickly bring you in, and let's hear what the African Union has to say and help close this panel.
Great. Thank you, Veda. And thank you all to the great panelists for rich and inspiring conversation. I think Africa and India is in good hands, because we had a full female panel discussion here, and you managed to not only speak about our problems, but you managed to share some solution-oriented perspectives. So I think that has been fantastic. I really, really want to allude to some of the points, because it was a really good discussion. From Desta, you reminded us how partnerships that are rooted in key health systems can serve communities with dignity and equity. We also heard from you how the South-South collaboration and how this can help shape markets for health innovation, and in order to drive smarter policies and strengthen local capacity. And the fact that Africa needs to find more innovative ways for domestic financing. Regarding the regulatory harmonization, you are very aware, and we are very grateful for your leadership, as well as the NEPAD works with AUC in championing AMA, which is the medicine regulation of the continent. And Desta, to you, thank you for actually leading this and bringing the key voice in advocating for the ratification and operationalization of AMA. So we're grateful for that. To Sayada, thank you so much that you brought in, I think, very sharp policy lenses to us and urging us to rethink financing and governance models, how we can seek accountability and reflect on some of the realities and aspirations of the global South. I think you also alluded about the fact that we have too many policies and prescriptions, but with zero action. And you're absolutely right that there's a need for bringing in the strong South voice to strengthen and address our needs through global forums. Also alluding at the end to how private sector then can maintain the equity. So in Njabulo, thank you very much for your interventions, and how you reminded us on how research and education are just not side notes. They are central to building long-term resilience and nurturing the next generation of African health leaders. But what is important, as you also concluded by saying, that it is inclusive to have a full ecosystem of infrastructure in order to do so. And of course, the big contribution there is how data should be used wisely and ethically, and how this can be a powerful tool for accountability and smarter decision making, especially when we have resource constrained settings that we have. And as the development agency, NEPAD, we are monitoring and evaluating and have a plan that is embedded in Agenda 2063, which is Africa's continental blueprint across all sectors. And we're working and accompanying countries on closing this development agenda gaps. So together with all of your insights today, you have made one thing clear, and that one thing is that Africa is not waiting to be saved. It is shaping its own future. And I think India, we know that India is already shaping its future. And through collaborative discussions such as this, through innovation and grounded leaderships such as the ones that you occupy in your space, we can truly build health systems that are not only, that will not only survive the disruptions, but also thrive through it. So thank you for being a part of this important dialogue. And I really want to extend heartfelt thanks again to CSEP for accompanying us on this journey. Thank you very much.
Thank you.
Thank you very much, everyone.
Thank you.
Goodbye. Good day.
Bye-bye.
Bye.